Imagine you could live to be 100 and happy you were 100. You weren't in pain, you had all your memories, your friends and loved ones were around you. Imagine that. Well, who am I to say that that's possible? So I'm a radiologist, and what radiologists do is we look inside people's bodies. We have X-ray vision. And I've been looking at blood vessels for over 25 years. And I'm here to tell you right now what I'm looking at are the blood vessels of the heart. And do you know that heart disease is the leading cause of death throughout the whole world? More than any other cancer combined, people die of heart disease. And we're looking at it, looking for heart disease in ways that are old. And there are new ways that we can see it. Your heart, I want everyone to make a fist. Your heart is the size of your fist. So your heart, your fist is the size of your heart, and my fist is the size of my heart. And it's a pump. And it pumps the moment we become alive till the moment we die. It never gets a break. It pumps and pumps. And heart disease is when the heart pump, the blood vessels, so this is going to represent a blood vessel that supplies the heart. They're really kind of like this. This is a bigger version of this blood vessel that supplies the heart. And when heart disease happens, it's the slow clogging of these pipes. So we've got the pump and the pipes. And the clogging happens with two different substances. So this is child's clay. Remember the smell of it? That's a bit like, this is heart disease. But there's two kinds of plaque. There's the soft plaque and the hard plaque. And what we look at is this soft plaque. And it can get in the arteries and cause heart disease. So the Scott Heart trial of 2020, not very long ago, showed us that this soft plaque is more likely to rupture than the hard plaque. And what happens when it ruptures, it's like a pimple popping in your arteries. And that's a heart attack. And we don't want that to happen. So I use a CT scanner. So this represents a CT scanner. And people have been asking me, why are you carrying this around? Well, this is my CT scanner. And so this CT scanner, we are able to see the soft plaque. So we looked at the first 100 patients of 2024. 83% had soft plaque in their vessels. It was in there. 83%. So to put that in perspective, how many people, what percentage of people do you think have the mammograms are positive for breast cancer? 20%? 30%? 50%? It's 1%. Less than 1%, actually. So less than 1% of mammograms, screening mammograms, are positive for breast cancer. So another screening test that's very common is a screening colonoscopy. Again, less than 1% are positive for colon cancer. and yet we're at 83%. And so it kind of all makes sense. Heart disease is the leading cause of death in the whole world, and we're just not doing enough right now. I had one patient came in, and he said, my dad died of heart disease in his 50s, but he was a drinker and a smoker, and I run marathons. I eat really well. Do you think I have disease? I said, well, let's take a look. So we put his heart with the blood vessels into the CT scanner and took a look. He had a lot of disease. He had a lot of soft plaque and a lot of calcified hard plaque. Another patient came in. He was a 49-year-old gentleman. And again, wondering if he had coronary artery disease. So we put him in the CT scanner for a coronary CT angiogram. What he usually does about 20 minutes of cardio every day and runs 10 to 20 miles every weekend. He had so much disease, it covered the lumen of the vessel, the inside of the artery, by 80%. It was nearly occluded. And this was the left anterior descending coronary artery. That is the artery that we call the widowmaker. Now, I don't like to use the term widowmaker. This is scary enough stuff as it is. But that's what vessel was occluded. And fortunately, he also didn't have any calcified plaque. So his calcium score was 0. But fortunately, we saw all that soft plaque, and he will be able to get treated. And he's being treated right now. The most common test we do right now are we look at blood levels. So we look at the blood inside the vessel, and we see that, we look at cholesterol, lots of inflammatory markers. We also look at the calcified plaque with a calcium score. And so I had 2 patients come in, both women in their 60s, both with high LDL cholesterol. And the first woman said, my mom is in her 80s. They've told her whole life she's had high cholesterol, and she's living her best life. She's doing great. She has no problems. People have told me I've had high cholesterol my whole life, and I don't want to go on the medications. Do you think I have heart disease? So we took her heart and her blood vessels and put them in the CT scanner. Nothing. Totally clean, even with high LDL. We put the second woman, got a coronary CT angiogram, and she had a ton, not 80%, but a moderate amount of soft plaque. And again, this soft plaque can pop like a pimple, and we don't know exactly when that's going to happen. And so she really needed treatment, but her calcium score was 0. So she may not have gotten treatment if she hadn't had a coronary CT angiogram. Now, as you may expect, I'm not that much fun at parties. I talk about this stuff a lot. It's my passion. And so people get a little afraid when I start talking about this all the time. One thing I like to do is I bring my dogs to work. And they are 2 of the cutest golden retrievers you've ever seen. And they take the fear out of this. And if someone's having a hard time, I ask them, do you want a little one or a big one, or do you want both? But I think we need to admit that this is scary. And people come in and they are scared, and they know of somebody who's had a heart attack, or they have a family member who's had a heart attack. And the good news is the medications work really well, a bit like drain cleaner. And new medications are coming out all the time that work really well and can make this dissolve and go away. So before you or a loved one have chest pain, around the time you may need a colonoscopy, I want you to check to see if you have heart disease. And I know it's scary, but it's also treatable. Thank you for your time.